Today I'll be talking about the cocktail antibody, Roche cocktail antibody, that is casirivimab and imdivimab. The dosage is 600 milligram and 600 milligram, which are given at the same time, whether it is intravenous or subcutaneous. So this medicine is basically indicated for all those patients who have mild to moderate COVID-19 illness, who have fever, weakness, tiredness, exhaustedness, means any one or more symptoms of COVID-19 illness, and those patients who are not needing oxygen or who are not needing hospitalization. The patient's weight has to be more than 40 kilograms of age. They should not be on any oxygen. Those patients can be taken if the age of the patient is more than 12 years of age, and patient has to have mild to moderate COVID. They should not be having severe COVID-19 illness. Uh, these patients have to be a high risk for development of severe COVID-19 illness. Then only these patients should be given this medicine. Uh, the patient has to be a lab confirmed, RT-PCR confirmed, or and rapid COVID-19 antigen confirmed case of COVID-19. There can be a severe allergic reaction also, which is possible if we give this cocktail antibody. There has been some anaphylactic reactions also. So this medicine is not given on OPD basis. This medicine can be only given in daycare facility, or we have to admit the patient and give this medicine. We can discharge the patient after giving the injection, after observing the patient for few hours, mostly for 2 to 3 hours. This injection, when it is given by intravenous route, has to be given at least over 20 to 30 minutes. And this medicine is not meant for those patients who needed hospitalization for COVID-19 symptoms, or those patients who needed oxygen due to involvement of the lung. And if the this is not meant for that those patients whose oxygen requirement increased because of the COVID, because so many patients can have some chronic lung disorder like asthma or COPD or other lung disorders where they are already on oxygen. So if the oxygen requirement increases due to COVID, that patient cannot be given this cocktail antibody. And the high risk is defined as those patients whose age is more than 60 years, those patients who are obese, those patients who have heart disorders like high blood pressure, chest pain, or ischemic heart disease, mean those patients who had heart attack, those patients who get shortness of breath or chest pain after doing minor activities, those patients who have chronic lung disorders like asthma, COPD, interstitial lung disorders, those patients who have chronic liver diseases like cirrhosis, those patients who have chronic kidney diseases or long-standing kidney diseases, even those patients who are on dialysis, those patients who are on immunosuppressive medicines like methotrexate or cyclosporine or other immunosuppressant medicines, those patients who have cancers, thalassemia, sickle cell disease, those patients who had transplantation like bone marrow transplantation, organ transplantations, or even in those patients who have HIV or AIDS. This medicine may have worse clinical outcome if it is given to those patients who are hospitalized for high flow oxygen, or those patients who are needing high flow oxygen, or those patients who are needing ventilator to maintain the oxygen levels. This medicine can cross placenta, but the effect on the fetus is not known well. So, if there is potential benefit after giving this cocktail antibody, then only this medicine should be given, and it is given in the same dosage. And the effect on lactating mothers has not been found, so it is difficult to say whether it can be given or not. When this drug was studied, there were two endpoints. The primary endpoint, what they found was the medicine which was given to all these patients who had this mild to moderate COVID-19 illness with all the symptoms, who presented in 3 to 4 days after starting these symptoms and who had high risk. They shown 70.4% reduction in number of patients with COVID-19 related hospitalization or all cause death. Means in short, patient those who received this medicine needed less hospitalization or died less. So the hospitalization can be reduced or the death can be reduced if you take this antibody, cocktail antibody, in initial days. The secondary endpoint was the time to COVID-19 symptom resolution, means those patients who presented within these 3 to 4 days, those patients who received this cocktail antibody, the symptoms associated with COVID 19, like fever, chill, sore throat, cough, shortness of breath, nausea, vomiting, or loss of taste, loss of appetite, loss of smell, or sneezing, runny nose, sputum, rash, these all symptoms resolved much early in those patients who received this medicine. They were all resolved within 10 days compared to 14 days in the placebo arm. So, in short, this medicine can be given to mild to moderate cases. This medicine can reduce the hospitalization related to COVID 19 as well as death associated with the COVID 19. Thank you.